Hello, I'd like to talk about the recovery for gynecomastia surgery. I do quite a bit of gynecomastia surgery, and it depends on the type of gynecomastia. And often there are two components. One is there's the glandular component, that's why it's called gynecomastia, right? And then there's the fatty portion or the lipodystrophy part. So often it's sometimes one or both or a combination. Either it's excision of the gland, that's often below the areola complex, or it's liposuction of the chest with removal of some of the subareolar tissue, or a combination. So based on that, the recovery actually is pretty simple for this. It's not particularly painful operation. There's no muscle excision. Operations that have muscle involved in them tend to be the most painful. And this is really, skin, some fat, some gland. So it's really not bad. So basically, after surgery, the patients wake up and they're wearing a compression vest. And the compression vest sort of looks like something like Under Armour. It is lightweight. It doesn't have an odor to it, and it's sort of snug. And I'll show you a picture of what it is. It's a custom garment, and at the time before surgery, we take a measurement. And this is the garment that the patients wear. And it's pretty sheer and form-fitting, and you could easily conceal it under a shirt. Okay, the next thing I'd like to talk about is the medications. So after surgery, the patients require some antibiotics to take by mouth. So I would write a prescription and you can pick that up for antibiotics. And then there's pain medication. And there are two types of pain medication that I prescribe. And one's going to be a Tylenol with some kind of coating, something like a Norco, something like that, just in case. And the other one is something called Celebrex. And Celebrex, it's sort of like Advil, but this one doesn't cause bleeding. So you take that, but it's a great anti-inflammatory agent. It lasts for 12 hours and for the first 5 days. And honestly, most of the patients just take that. And the other one is just in case they feel like they're having some pain or they're panicking, at least they know they have something else to take. But the majority of the patients just take the Celebrex. Okay, the other thing too is that I would like to talk about the follow-up care for the patients. So that evening, I call the patients, see how you're doing, and you can tell me, and I ask just basic questions about the chest, and I ask them just how they're feeling, and remind them to take their antibiotics, and review the pain medication if they have any questions. And then I always see the patients the next day. It's always good to have an inspection and reassure the patients that things are going in the right direction. And following that, I usually see the patients maybe once a week for the first 3 or 4 weeks. And most of the patients wear their garments for 3 to 4 weeks. And after that, they're ready for the beach. But it's a relatively smooth and easy course post-operatively, and the patients are quite pleased. Thank you.